So today we're going to bust the myths and bust them wide open.
Ooh, age is no barrier to having a sex life.
Sex means penis and vagina intercourse or penetration of some kind.
What we are taught, whether it's just in our families and our religion, about sex.
So we are back with week 2 of Sexual Health Month. My name is Christina Peoples. I'm a gerontologist and the creator of Gero-what.
I'm Christina Saldanha. I'm a women's health PA. I specialize in menopause, sexuality counseling, and maternal mental health, and I'm the owner of Camel City Women's Wellness.
I am Kampen. I'm a doctor of physical therapy. I specialize in pelvic health physical therapy and own Triad Pelvic Health PT in Greensboro, North Carolina. And today we are getting back to our topics on Sexual Health Month. And we just want to say up front that we are about to unpack all of the things that you never wanted to ask or never thought you could ask your healthcare provider. So don't worry if you feel a little uncomfortable with the things we're going to talk about. Know that most folks aren't. We're not exactly invited to talk about these things in our culture. So don't worry, we've got you. We are trained to talk and ask about all these things. So we hope to give you some new ideas and new thoughts and new permissions to think a new thought about your sexual health. So today we're going to bust the myths and bust them wide open.
Ooh, all right. So let's get to it.
Myth number 1 is sex means penis and vagina intercourse or penetration of some kind. So this is what I call, or we call collectively as a sex positive community, as a narrow sex script, meaning that sex does not necessarily have to just include penetration of some kind. There are all different types of sex, including touch, oral sex, anal sex, as well as masturbation, meaning that you don't have to necessarily have a partner to engage in sex. So sex can be penetrative or not. And we like to dispel this myth because a lot of times when we're talking about sex and having sex, we frequently are referring to in some sort of way penetration, but really you like to break that stigma that sex does not have to include just this one type of activity.
Yes, especially in particular because it leaves a lot of folks feeling disappointed or like they're not okay if they're not having this type of sex, in particular some sort of penetrative intercourse. And so we just really want to help folks have a new thought that sex and sexuality can really mean this whole pie. And that penetrative intercourse of any kind is sort of one piece of that pie. But there's this whole other, 7/8 of the pie that can also be really delicious and fun and satisfying, and it counts too. So we just want to let folks know that sex doesn't have to mean this one narrow script. So as long as it's pleasurable and enthusiastically consensual, it counts as sex.
Myth number 2 is sexual activity is not good for your overall health, or what good is sex for the aging body? So sex, as we just discussed, can be any type of sex, causes arousal. And arousal is the physiological or your body's response, which includes increasing blood flow to your genitals. Blood flow keeps the vulvovaginal tissue as well as the penis healthy, and it prevents dysfunction or prevents things like thinning of the tissue, and it can actually prevent or help encourage normal erectile functioning. So just like any other part of the body, if you don't use it, you lose it. And so regular arousal and orgasm can help promote healthy circulation as well as healthy hormonal activity. There's some other benefits to sex that sometimes we don't recognize or realize or give attention to, and these include that sex is a natural painkiller. It helps to release your body's own endorphins and kind of makes you feel really, really good, including decreasing your pain. And as well as sex can lead to better sleep. Orgasm can help improve sleep and has been looked at as a treatment for insomnia. And also regular sex can help strengthen your immune system and again, improve and maintain overall body functioning. Myth number 3, there is nothing we can do to improve our sexual health over time. So you may be wondering, well, if I get to a certain age or something in my life happens and I'm no longer to have the certain type of sex that I think I should be having, or the sex that I was having before. That is not true. There is always things that you can work on, especially if you're working with a professional such as one of us, and basic health goes a long way. So a lot of times what I talk to clients about is really basic things, or what we think of basic things, but sometimes we forget if we're doing these things, such as making sure we stay well hydrated, managing our constipation, decreasing stress is a huge one, improving your sleep hygiene, as well as working with your pelvic health.
And also things like maintaining good pelvic health in terms of your pelvic floor muscles, making sure they're strong enough and long enough and not too tight, can really go a long way in helping make sex more comfortable, which will make it more pleasurable and improve our outlook towards it. Also, maintaining a good hormonal balance. So if you're feeling like something is off in your sexual health or activity, asking your healthcare provider if looking at a hormonal workup might help shine a light on what's going on. And then also maintaining good cardiovascular health. So like Christina said, arousal, erection, things like that are described as an increase in blood flow and circulation. So sometimes erectile function or arousal in the genitals can be related to cardiovascular health. So making sure you're taking good care of your heart, exercise, eating well, things like that, and stress. So myth number 4, God does not want you to have sex. So this is a tricky one, and we've really debated whether or not to even discuss this because it's such a big topic and very, very deep-seated in many folks' experience. But we felt like we couldn't have a good conversation about sexual health if we didn't lay it out there to explain that there is a correlation between what we are taught, whether it's just in our families and our religion, about sex, whether or not it is shameful, or if we have very conservative upbringing about it, that will change our body's response to sexual activity and arousal. So what we are taught for many, many years will change the body's ability to respond to pleasure and touch. So we just wanted to present that information so that if I'm having pain with sex in particular, there's research that shows that folks that have conservative views of sex will be more likely to have pain in the genital area or painful sex. If that is part of your story, know that it's not just you, and that there is help, and that you should talk to a healthcare provider to figure out what you can do to increase your pleasure, decrease your pain, because it is part of your overall health picture, and it doesn't need to be an uncomfortable experience.
Myth number 5, there is no such thing as having too little or too much sex. As a sex counselor, I will likely never tell you that you are having too much or too little sex. A lot of times people come to me with, I want to have more sex. My partner tells me I need to have less sex. And really, it's not about compromising with one another. It's about collaborating with each other. We do know that sex is very healthy, as we've already discussed, and that increased sexual frequency in older adults actually leads to improvements in cognitive function, including memory as well as executive function. So there's another benefit for you. And then also 3 different studies altogether, including 30,000 participants, showed that for those in relationships who have sex once a week, they reported overall greater well-being, both individually as well as with their partner. So again, more benefits to having sex, but there is no such thing as having too much or too little sex, as long as the sex you are having is consensual with a consenting adult.
It does seem like over and over, Christina, in the research we see kind of that once a week is a pretty sweet spot in terms of overall physical and mental health benefits. And it's similar to kind of like going to the gym. It's something where if the more frequently you go, the better off your health will be. So that's the good sort of analogy to shoot for. Once a month is better than none. Once a week is better than once a month. And again, just remember, this doesn't have to be partnered sex. So it can be on your own in any way that feels good to you. And in particular, having the physiologic benefit of orgasm or climax really changes what's happening in the body in terms of muscular function and cardiovascular changes in the genital areas.
Myth number 6. people of a certain age don't or shouldn't have sex. I just want to go ahead and say age is no barrier to having a sex life. So as we continue aging, the sexual activities that we participate in, they might look different, as we're getting older in comparison to our younger years, but our age doesn't have anything to do with that. Being older does not make you asexual unless that's your choice. So people believe that sex doesn't exist in elderhood because of the lack of conversations that we're having related to sex and getting older. A lot of people think that's something that's more for younger individuals, or they see older adults having sex as being taboo. It's like, you shouldn't be doing it. But we should have more conversations about this, because studies show there's a large percentage of older adults who actually participate in some form of a sexual activity well into their 80s. So it's important that there's more conversation, more support around this, and that we get that clear idea or clear note, make a mental note that our age is not the reason why we can't have sex or why we shouldn't be having sex.
And further to support that, not only are older individuals interested in sex and still having sex, they are actually more likely to act on their fantasies and their desires compared to younger folks. And we think that this has to do with them just being more comfortable in their body, more comfortable in their relationship, more comfortable with themselves, and as well as not being scared of fear from their partner or not living their true self. So not only are older individuals wanting to have more sex, they are also partaking in and acting out some of their fantasies as well as their desires.
And in terms of kind of physical therapy and the intersection of age and sex and sexuality, as healthcare providers, or if you are an adult child who, if you're an adult child and have a parent who maybe or may not be sexually active, it's important to stop perpetuating these myths and kind of doing the, oh, gross, or just not talking about it and those type of things, because that will just kind of continue to build shame around sex and sexuality. And it's just not helpful for anyone. So if you're a healthcare provider, ask the questions. Are you sexually active? How's that going for you? Because some folks, as other parts of the bodies kind of change and go through different injuries or whatnot, they may be having back pain with sex, and so that's limiting them, or having pain in their knees. And so helping with modifications in these ways can help improve the overall health picture of our patients and our family members if we know and can support them in healthy ways.
Number 7, as you get older, safe sex isn't an issue. And what we're trying to really point out here is that as you age, safe sex considerations still need to be thought about. We still need to be thoughtful in preventing infections. A lot of times, older individuals will no longer use condoms because there's not a fear of pregnancy after females go through menopause. However, there is still a risk for infection. There's always a risk for an infection. And as women particularly age and they lose that vaginal estrogen, the tissue becomes thin and a little bit more friable and more susceptible to tearing, which can actually increase a woman's likelihood of contracting an infection. And just overall, individuals aged 55 and older, the CDC did a study and they showed that between 2014 and 2018, gonorrhea, syphilis, and chlamydia rose tremendously amongst this age group. So for sure, age is not a condom, and that we need to be thoughtful and consider this with any type of sexual activity.
I'm one of those, I'm sure you all could agree, like I do think that there's more training and education needed, just with reference to healthcare professionals. They need that education and training on how to address this with reference to sexual health in elderhood, because it's like that one piece that constantly gets overlooked because of assumptions and stereotypes regarding older adults and sexual health.
Mm-hmm. And Christina, that's why I'm glad that you are such a big advocate of healthy aging and the concept of ageism, because as healthcare providers, it is something that we oftentimes are blind to, and we kind of continue to perpetuate these presumptions that aren't helping anyone. So I'm thankful for the work you're doing.
Thank you.